have a responsibility together to provide the best preventative care we can to this community, to provide the best care possible during the acute, oftentimes inpatient period of time, but to ensure when the patient goes back home that we truly have helped them so that they return back to what they were used to doing.
As a healthcare provider, being able to communicate in your native language, being able to understand some of the customs, some of the culture that is behind how a patient interacts with a physician. Those are all important things that if you have an appreciation for, you will make your patient feel a lot more at ease, more comfortable with you. You will learn a lot more about what's going on.
The residents that come to Children's Hospital are very much the heart and soul of this hospital, working very closely with our nurses. And from the internship through the second and third year and fellowship beyond, this hospital's reputation for excellence is based primarily on the residents and the fellows who work here and train with our faculty.
With the changes in residency requirements, we have to be more creative so that in a more limited period of time, we have the ability to produce exceptional caregivers that respect the very diverse community within which we live and within which we have a responsibility to care.
My name is Cynthia Rogers. I am a child psychiatry fellow. I'm originally from Louisville, Kentucky, and I'm finishing up my fellowship.
I'm a second-year resident in the Department of General Surgery. I'm originally from New York.
So my name is Greg Nelson. I'm a second-year resident in orthopedic surgery. I'm not originally from St. Louis. I actually grew up in Baton Rouge, Louisiana, and spent some time down in Texas before I went off to school in Boston. I went to MIT as an undergrad and then medical school at Yale. Made the switch from engineering to medicine.
From Denver, Colorado. I did my undergraduate education at University of Colorado Boulder.
My name's Patrick White. I'm from Akron, Ohio. I went to school at Notre Dame and did my medical school at Ohio State.
I'm an East Coast girl. I grew up in New Jersey. I went to college at Harvard in Boston, and I was living in Boston working for a healthcare consulting firm when I applied to medical school a couple years after I graduated.
I struggled for a little while deciding if I really wanted to leave the East Coast, but I just went for it. I had a really good feeling about the place, and I have not regretted it for a moment.
One of the great things about being on the faculty here is the opportunity to collaborate with other world-class investigators and clinicians. The great thing also as it relates to residents is that they have a direct line to the attendings, and I think at many places they don't have that access.
Something that we have different here that attracted me to is that we have a chief resident who spends a year extra, and so instead of having just a regular attending and trying to find time, there's someone dedicated for our teaching at all times, and there's someone to staff with at all times at this program.
One wants to be with peers or with a medical center that's going to prepare them for the future. And I think that Washington University Advanced Jewish Hospitals is the place that is best suited to provide that for a kid from any background.
It takes a student to really understand that we have a mission. It certainly is beyond the academic mission, beyond the biomedical research, all the incredible things you hear about this school. It really is a mission to develop leaders in medicine.
We're level 1 trauma centers in both Barnes and Children's. I wanted to do, all kinds of cases ranging from transplants to vascular surgery to, cardiothoracic surgery. Everything that you pretty much, have or you need, I feel like I need it in training I have here.
Well, obstetrics and gynecology is 4 years here at Barnes-Jewish Hospital, and basically on a day-to-day basis you are involved in patient care. So, you know, you get here early in the morning, and whether you're on labor and delivery or going to the main operating room, you are writing the orders, you are, you know, doing the physical exam, you are consulting with maybe ancillary staff or the associated services like social work, pharmacy, trying to come up with a plan that's comprehensive for the patient.
We have some surgeons who are like world renowned for what they do. One of our vascular surgeons is what I'm thinking of in particular. He has patients coming in from all over the U.S., California, Washington. I mean, it's just amazing where these people come from.
The medical center brings a very rich educational environment and a positive learning climate. And part of that climate is mentorship. So every single intern is paired with an outstanding faculty physician who wants to mentor.
It's really important for us to have an interaction with the residents, because these are the people that we hope will stay on to be on the faculty and remain on the staff at the hospital. It's extremely vital that we have a great group of residents who will continue to stay in our system and help as we try and eliminate some of the health disparities that are linked to the lack of diversity in our workforce.
I love St. Louis. I was actually very pleasantly surprised.
One of the things I really liked about St. Louis was that it was just the lifestyle was so much easier and the cost of living was so much lower, and the people were a lot friendlier.
I think the cost of living is incredible. So, you know, we bought a house right down in South St. Louis.
I was excited because I could rent an apartment by myself compared to some of the other places I was looking where I wouldn't have been able to afford that. I would have had to live with 2 or 3 roommates like I did when I was in San Francisco, and I didn't want to do that anymore.
We just keep making lists of things to do, and you know, we're constantly trying to check off all the things that we want to do here because there's so many fun things going on.
Here there's Forest Park, there's Tower Grove, there's so many different places where you can actually go, you know, for a jog or for a walk.
There's a lot of free stuff to do here, which is great on a budget. And in general, the cost of living in St. Louis is a lot cheaper than most places, which you really start to appreciate when you have all your loans after medical school and you're not making all that much money as a resident.
One of my favorite things to do right now is to jog to the Arch. The first time I did that, it was one of the most exhilarating feelings I've ever had. My classmates had on the snow day, took a big inflatable sled, spread Pam on the bottom, and went down it when we were getting like 2 inches of snow one day. Bad driving weather, but I guess good sledding weather.
You're able to kind of step away from the hospital and do something outside of yourself, and it's really refreshing.
The thing that really sets WashU and Barnes apart is that people have that love for getting involved in the community, and there's just so many opportunities with what this committee offers.
There happens to be a wonderful program called the Resident Fellow Diversity Initiative, and I was so pleased to be chosen to be a part of that initiative because to me that's why I signed up to be a medicine participant in the first place.
So far I've been involved a lot with elementary school kids and going out to talk to them about what it's like to be a doctor and how hard it is to get through school, and we try to motivate them, and it's really fun.
And then we do one-on-one counseling, and that's when we've got some of the best encounters. You know, we've had patients come up and ask us, you know, I was really scared to use my insulin because my dad used insulin and went blind or lost his leg, and we can kind of go through some of these things and hopefully help people to understand their disease better and take better care of themselves.
I think it's really good that I think being part of the Resident and Fellows Diversity Initiative kind of gives you the spark to remember, okay, you know, I really can take an afternoon off to go and work with some 10-year-olds and remind them why science is fun.
And it's just one of those things where, you know, if you have time, there's so much to do, so much to get involved in. I think the diversity office here really does a great job of just kind of letting everybody know what's going on.
When I went to Washington University for medical school, there were a lot more diversity with, there's people from all over the country there, people of all ethnic backgrounds there, and it was really nice.
All the residency programs here attract a wonderful population of residents that come from essentially all over the world to train here. And they do that because of our wonderful population of patients and the unique situation we have here with a world-class research, teaching, and patient care institution in Washington University, and paired up with Barnes-Jewish Hospital, which is recognized year after year as one of the top hospitals in the country. So we have this interesting mix of patients that spans the spectrum of patients who come here every day for their primary care through our medicine clinic, our surgery clinics, OBGYN, pediatrics. But then we have patients literally coming in from around the world for some of these advanced procedures that we can perform here.
As Children's Hospital becomes a more nationally recognized hospital and families travel here from farther and away, for instance, we treat families from every state in the United States and over 60 countries outside of the United States, you can imagine the wide variety of backgrounds and situations, circumstances that these families arrive here with. It's our goal at Children's Hospital to have a staff who understands and appreciates these backgrounds and interacts with them effectively so that families are comfortable coming here and feel when they leave that they have been served by a very sensitive group of individuals, care providers, who have taken care of their needs and have exceeded their expectations.
I think that we have a unique opportunity with the Residents and Fellows Diversity Initiative. We have a funded program of dedicated physicians who are dynamic and are visionary, who want to make a difference in the community, who are doing that, going out into the community, thinking of new ways to do it all the time.
I think just by having diverse ideas, not necessarily just skin color, but having diverse ideas, diverse backgrounds, it really helps people kind of grow.
I think that there's a wider awareness of how diversity contributes to a better workplace for everyone.
One of the things I really love the most about the program is that I am inspired when I go to the meetings, right? I don't think that I'm doing much, but I hear what everyone else is doing around me, and I think, I can do that. I can do more. I can do better. We can do this together, and we can really make a difference in terms of increasing access and providing better care to people who are going to be overlooked and forgotten about.
I think when people are at the level of trying to find a place to do their residency, they're obviously very high-functioning individuals that have had a lot of accomplishments, so they're going to have a lot of options. But I ask them to seriously take a look at Barnes-Jewish Hospital, because I think they'll find that not only will they get superior medical training, but they'll also find that St. Louis is a great place to live.
I think that's what makes WashU so extraordinary, is that it's really a place that invests itself in people and the people who matter to those people. I've made it clear that I want to start a family during residency, and I've only gotten support about that, and I'd say everyone in our program would echo the same thing.
The hospital, too, has a great daycare that you can take advantage of. When you're a busy resident, it can be really hard to find childcare, and our daycare is open from 6 a.m. until 6 p.m.
Why I liked WashU was the students just seemed so happy, and so I thought that was a good sign, and everybody was just so nice and friendly and seemed like they really wanted to focus on education.
I chose this program over all the programs that were available because I think this program has an unparalleled clinical experience in terms of the breadth and width of things that we'll see, the number of practitioners that we have.
I think one of the differences that I've felt at WashU that I didn't necessarily feel in other places was a real focus on the students, and the residents, and always trying to evolve and make things better.
But I'm ready for the challenge, and I feel like I've been prepared really well, and I wouldn't change anything.